Bronchitis. Bronchitis means it is the inflammation of bronchi in the lower respiratory tract, mainly due to infection. So, bronchitis is divided into two forms, that is acute and chronic bronchitis. The main etiology for bronchitis include mainly it is caused by infection. Okay, that's why it is infectious bronchitis. Usually the viruses, bacteria, atypical microorganism, fungus and protozoal bronchitis may occur. In virus, usually the rhinovirus, influenza virus that cause bronchitis. In bacteria, the Streptococcus pneumoniae mainly cause the bronchitis. Then in fungus, the Aspergillus is the main causative agent. In non-infectious cases, it is due to the influence of various allergens, toxic substances, physical factors on mucous membrane. So non-infectious means mainly due to allergens or toxic substance like smoking, some irritants or some physical factors that affects the mucous membrane. So that is known as the non-infectious category. Then mixed etiology, that includes the infectious factors as well as non-infectious factors. The main pathophysiology of bronchitis include the etiological reasons, maybe cigarette smoking or infections or environmental pollutants. So the etiological factors that leads to inflammatory response in the body. That's why there will be release of bradykinin, histamine and prostaglandin. So when there is release of bradykinin, histamine and prostaglandin occurs, there will be increased capillary permeability. So that leads to fluid and or cellular exudation. That leads to the edema of mucous membranes and hypersecretion of mucus. So that leads to persistent cough. So the acute bronchitis, the main symptom is cough. Okay, so the person will have persistent cough. The common symptoms of bronchitis include frequent cough, headache, fever, shortness of breath, weakened immune system, body weakness and discolored mucus. It may be sometimes it may be greenish appearance also. So the main symptoms include the frequent cough. That is the very important symptom of bronchitis. There will be frequent cough and headache will be present, then fever due to inflammatory response, then shortness of breath, that is mainly due to severe cough. There will be shortness of breath and tachypnea will be present. Then body weakness, because the persistent cough that will increase the metabolic rate of the person and the person will not be able to have adequate food. So the patient will feel the body weakness, okay, or extreme tiredness will be feel, and due to the inflammatory response and all these features, the body immune system will be decreased. But in case of chronic bronchitis, the symptom will be little bit different. That is the frequent cough with mucus. That is 3 months of the year for at least 2 years. So the chronic bronchitis person will have recurrent episodes of bronchitis. So they will have the frequent cough at least for 3 months of the year. Then shortness of breath or dyspnea. Then fast heart rate. Not only fast heart rate, there will be tachypnea also will be present for this chronic bronchitis patient. Then whistling sound when you breathe. That means when you are auscultate the person you can hear the musical sound or the whistling sound you can hear, then extreme tiredness or fatigue will be present for the person. And extreme cases there will be cyanosis, hypoxemia, hypercapnia, and decreased exercise tolerance. All these features will be exhibited by the chronic bronchitis patient. The diagnostic measures include history, physical examination, chest x-ray, sputum culture, pulmonary function test, then spirometer exercise, then bronchoscopy, then ABG analysis, etc. So in history collection, you have to assess the history of viral infection or bacterial infection, or the history of irritants or the allergens, etc. Then physical examination, you have to hear for the, or you have to wait for the whistling sound via stethoscope. Then chest x-ray, the inflammatory response you can see, the sputum culture, the presence of bacteria you can identify. Then pulmonary function test, you can identify the decreased residual volume and decreased forced expiratory capacity. All these things you can assessed by pulmonary function studies. Then spirometer exercise also can identify the functioning of the lung. Then extreme cases only we are doing the bronchoscopy. The treatment of bronchitis, it includes antibiotics, beta-2 agonists or steroids, antitussive agents, anti-inflammatory medications, expectorants. So usually we are giving more importance to the bronchodilators, especially the nebulizing agents, albuterol, salbutamol, etc. So that will reduce the inflammation in the bronchus, and the person can easily breathe if after the nebulization. Next one, we will give antibiotics based on the type of infections. Okay, usually we will start with amoxicillin or amoxicillin. Then we will go to the another drugs. In case of viral infections, we will start with fluvi. Then beta-2 agonist or the steroids. Usually the steroids, we will start with steroids BD, starts with BD dose, then tapering the dose gradually. The dexamethasone is the drug of choice. Then antitussive agents, especially in dry cough, dry irritant cough, we are giving the antitussive agents. The dextromethorphan is the drug we are usually using. Then anti-inflammatory medications, especially steroids or NSAIDs, we are giving. Then expectorants, especially in productive cough, in order to remove the sputum, we are giving the expectorants. Then another medicines such as non-pharmacological methods, especially the postural drainage, that will be very helpful for this patient. So that will helps to reduce the sputum. Okay, the sputum will be cough out. So that's why postural drainage will be easily helpful for the patient. Then steam inhalation, the mucus will be steam will be dilute the mucus, that's why it will come out. Then moist heat application also a good method. Then humidifiers. Then in case of extreme O2 decrease O2 level is present, then we will give the O2 supply or O2 administration we will do. So these all are the management for the bronchitis. So in bronchitis there are two types of bronchitis. Acute means a sudden occurrence of disease or sudden occurrence of inflammation of bronchi, and chronic bronchitis means there will be excessive production of mucus in the bronchi accompanied by recurrent cough that persists at least 3 months in each consecutive year. So, if there is recurrent episodes of bronchitis, that leads to chronic bronchitis. Okay, so we have seen the etiology. So, there will be infectious etiology, non-infectious etiology, and mixed etiology. Then the signs and symptoms, usually the fever, cough, chest pain, headache, then dyspnea, tiredness, all these features will be present. In case of chronic bronchitis, the person may goes to the tachypnea, tachycardia, cyanosis, all these features. Then diagnostic measures, usually history, physical examination, etc. The sputum cultures, X-ray, all these things. Then treatment options based on the condition, especially we starts with nebulization, then antibiotics, then cough suppressants, steroids, then antitussives, etc. So I hope you understand regarding the bronchitis. Thank you so much.